I'm Jodi Glacer. My company is called Senior Care Authority, and I'm a full-service placement agency, and I do also some elder care consulting. So obviously this information is not for anybody that's on this call. This information is for you to have so that while you're working with your clients, you know, we all want to go ahead and be full-service providers and provide information to our clients for any and every situation that they may bring us. And that's what I try and do when I meet somebody and I have a client. I've worked very hard to know everybody in the elder care space so that if I don't do what they're looking for specifically, then I can go ahead and suggest the right person that they can go ahead and be speaking to. So most of the time when I get a client, usually 2 or 3 other people get a client as well. So this information is just kind of for you to put in your back pocket, and when you run into people that need my help, you know, of course, you know, feel free to have them call me directly, or you can call them whatever you like. So I usually work with adult children who are in their 50s and 60s, who have family members who are in their 70s, 80s, and 90s who are not doing very well. And they need some help with elder care, but they're not sure what they need, or they may know what they need, but they don't know people in the arena. Since I've been doing this, mostly what I'm doing is I'm helping people find assisted living, memory care, independent living, or small residential care homes. But I also help people with any elder care issues that they might have, because like I said, I work really hard to get to know people. So since I've been doing this 4.5 years here in Palm Beach County, I cover Palm Beach County and North Broward, and I have somebody that I work with that covers South Broward and Dade County, so I cover the Tri-County area. There have been over 30 new assisted living facilities that have gone up, and I'm talking about from scratch. Plus, a lot of them have renovated, so there are literally hundreds of choices that are here in the North Broward and Palm Beach County area. That's not even including South Broward and Dade counties. There have been more places that have opened up since then. Most people are very overwhelmed because they don't know where to start, and they need somebody like me, but they don't even know that I exist. So what I thought I'd do is talk a little bit today about what the common issues are of families of who I work with right now as far as COVID, the state of senior care during COVID, and how Senior Care Authority can help. So right now, who I'm working with mostly would be either spouses or adult children who are caring for their loved one, and they either are A, afraid to have care that come in because of COVID, or B, they do have caregivers that have come in, and they are running out of money because having home health care coming in for 24/7 or even any more than 7 or 8 hours a day is a fortune. And so people are kind of frazzled at this point because they've been caring for their loved one at home. So that's basically who I'm working with. People who can choose whether or not to move right now are holding off because they're afraid to go into assisted living facilities. They don't want to be exposed to people that are coming and going, and I don't blame them. The people that I'm usually working with, like I said, are caring for their loved one, and they've kind of worn out. They're worn out. Mostly it's people who are caring for someone with memory care issues, and they really need to make a move right now. So that's what I'm seeing right now. The state of senior care during COVID. So the governor finally said last week on Friday that we can go ahead and have people start coming to visit our loved ones. There have been a lot of issues because people are living in assisted living and they can't even come in to see their families. And it's been interesting because a new criteria of assisted living facilities, people are saying, I need to be able to visit my family member through a window. That's where we are right now. So it's really gotten to be tough. But now we're going to go ahead and be allowed to come in and visit our loved one. It's going to be scheduled visits. They may be inside, they may be outside. All the assisted living facilities are putting together their plan. And I think a lot of it's going to be outside personally. I don't think people are going to want to have people come in right now. So that's a plus. So that's kind of change, and that's a better state. People have to be tested for COVID within 3 days of moving into an assisted living facility. So they're being very strict about that. And then when they move into an assisted living facility, they have to quarantine. It depends on each place. And now that we're opening things up a little bit, it might be easier, but it's usually been 14 days quarantining in your apartment, and then you can come out. They're having activities, but they're practicing social distancing and asking people to wear masks. With memory care, it's very difficult to go ahead and have people do those things. So they're a little bit more lenient with that. They don't do that as much. So that's kind of what's going on right now. Everyone's allowing people to move in, but it's just whether or not people want to make the move right now. It's really tough. What I can do to help is I actually go ahead and check all of the state ratings. So each state has a website or has information that tells you all about the citations, because here in Florida, the state goes in to every location every 2 years, and if they don't meet certain criteria, then they write up a citation. So I can check all the citations out for everyone, and I look at all the places on a regular basis. Also, if anyone complains, those go on the citation list as well. So I always check that out. I also have been to all the places physically, including the ones that are new that have opened up. There haven't been any that have opened up during COVID, but there are some that opened up prior to COVID. So I've been to all of those, and literally a couple that have just opened up, I've been to those too. So the ones that are just opening, they're allowing people like me to come in and visit before they have people move in. So I have all of this in a big database. I will go ahead and check the state ratings. I've been to the places, and then I know how much they cost, what kind of people they care for, what kind of activities they do. They have different levels, though, also of the assisted living facilities. There's standard level, there's a limited nursing level, and there's also an ECC, which are for people that they can do almost all complete care. So depending on what the person is that's moving in, I understand what health issues they have, and I can help the family decide what actually they need. And that's what I do for people. Also, like I said, I know a lot of people in the different communities, or rather that do different things. So if people need home health, I can also help them find home health. I know elder care lawyers. I know people that specialize in real estate, for senior real estate specialists. Anything to do with senior care, I can help with. Let me open this up. Does anybody have any specific questions for me on anything right now?
Do you only work are you in the Florida area?
I cover the tri-state or the tri-county area, but I'm part of Senior Care Authority, and we're a national franchise. So people often will come to me, and I can help them in other states by connecting them to somebody who does exactly what I do in another state. And funny, it seems as though I work with a lot of people that are out of state as far as the adult child. The adult child's up north, and their mom or dad live, or aunt or uncle live here, and they need help. And I've helped people who can't even get in an airplane right now. We do virtual tours right now as a big thing. So we're not doing home tours. We're not doing tours in person. We're doing virtual tours, which you really could get a lot more out of it than you think that you could. So
I have a question. I don't know if you'd be able to help me or not, but my brother is 50s, but he's legally blind. And I need to try to I have someone to be his caregiver, but do you help with like the steps to get them to be the caregiver?
Yes. So basically, based on what your specifics are, I can help you find the right caregiver. As far as I work with agencies only, but the right agency. I do specialize in 65 and older, so it's a little bit more difficult because I haven't focused on caregivers that cater to younger people who are blind. But I can help you with suggesting some places to you that might be able to help you.
Okay, that'd be great. I'll set something up.
Okay, great. Thanks. And I saw another hand, David.
Yeah, my mom's up in assisted living up in New Jersey. And with all this stuff that's going on, they've allowed her to go in and go out because my sister lives there and they bring her home. So my question for you is this: how does one determine when it's better to take your mom out of a place than leave her in the place? Because the places don't like to share all the information. And we're confused because it's a burden on my sister to have her stay at the house as well. So how do you determine as a family what to do?
Well, it doesn't sound like that assisted living facility is meeting your needs, that they're not communicating with you. Is that what you're saying?
No, it's just being scared that your mother's going to end up getting something in one of these places because they locked them all down into their room and they can't go or do anything.
Yeah, that should start. I don't know how it is in New Jersey. So, but yes, that is a problem. I mean, listen, it's a really weird situation right now, and it's really hard on seniors, especially because they don't understand. They don't have the coping mechanisms that younger people have because, they're older and it's too taxing on them. So each family has to make their own decision. I mean, there's no wrong or right answer in COVID when it comes to your loved one. It's really how you feel. If you're not able to take care of her at home, it probably is better for her to be somewhere. But there are also, I don't know if you have that in New Jersey, but here we have residential care communities, and it's living in a large house with 6 or 8 people with 2 caregivers, and that might be the right situation for someone. I just don't know if they have that in New Jersey. I do have counterparts that live in New Jersey that if you wanted to connect with somebody to talk about the specifics of what you think that your mom needs, and if you could find a place that matches that, I'd be happy to help you with that.
Thank you.
Mm-hmm.
Hey, Jodi, I had a question, just a general question, with what's going on with COVID and the restrictions, it seems like an unprecedented situation. But what typically happens like every year when flu season rolls around? It's an easy time to catch a cold. Do these facilities typically restrict entry or have other types of measures in place for those situations?
In assisted livings and memory care, they don't generally. They haven't up to now. Now, will things change? It's quite possible. I do know, though, that if they have something like a flu or a stomach virus going around, that they will go ahead and stop tours, and they do have some limitations based on having people come in from the outside, but they haven't been restricting up until now entry.
Right. So this is completely unprecedented in every way, I guess, in that sense.
Mm-hmm.
Yeah. And one other follow-up question. I know the range of facilities vary, and there's a stigma on, nursing home. The word nursing home is generally not used.
Right.
A lot of these facilities today are just like any other type of residence where maybe a 55 plus person can just have their own apartment and live the life they always want to live without having care attached to that. Can you elaborate a little bit on how that works?
Sure. So there's independent living, which really are for people that can take care of themselves physically, but they just need a lighter load in life. So they move into a place, it's a rental, so everything is taken care of. They don't have to pay any bills because it's all paid for together. Independent living usually includes 1 or 2 meals a day. They do have a full kitchen, though. They have activities. They'll drive you to and from the doctors, and they'll clean your apartment on a weekly basis, change your sheets, change the towels. Assisted living is a little bit different. It's when people need some help, and so they will have there are caregivers there are aides, and each person has a care plan, and based on their specific needs, they'll have people coming in on a regular basis to help them with the activities of daily living that they need help with. A nursing home here in Florida, we have nursing homes. They're called skilled nursing facilities. They changed the name because of the fact that there's such a stigma, so they just basically changed the name. Skilled nursing facilities have 2 parts in Florida. There's the rehab part where people go for rehabilitation and they're there for a short period of time. And then the other side is the nursing home side, which is long-term care, they call it, and people live there. I try and help people avoid living in a skilled nursing facility at all costs. It's like living in a hospital. You usually have to share a room with another person. It's for people that need invasive treatment on a regular basis, a daily basis. There are places like assisted living facilities that have ECC licenses that you can live in instead, or you can go ahead and live in a small residential care home and get almost the quality of care. The problem is when you can't stand on your own and even have one or two people helping you and you can't stand or transfer, then that's when you have a problem getting into an assisted living facility, and you'll have to go into a nursing home because there are rules and regulations. Now, once you can't stand or walk and you're already in assisted living, you can stay there, but there are criteria for moving in. I hope that clears it up.
Yeah, you nailed it. There's so much there, but thank you for clarifying. I know a lot of people are unclear on that topic.
Mm-hmm.
Thank you. Does anyone else have any questions? Go ahead.
You hear me?
Yes.
So maybe you already said it, Jodi, and thank you, because this clarifies so many things that we have no clue. But so you also advocate for the patient, right?
I do.
Yeah.
Yes. So,
okay.
yes. So when I go ahead and when I talk to somebody, based on what they tell me, and it's a long 15 or 20 minute conversation, I will go ahead and suggest 3 places that I think are most closely going to be a closest match. And that's physically, mentally, and financially. And so then I will go ahead and set up the virtual tours now, and I will actually be with the family on those tours, and I represent the family and make sure that all their questions get answered. And I also will go ahead and act as a buffer between the salespeople and the family. So the salespeople can call me for updates. The family can call them directly if they like, but if they don't want to, they can work through me. And because I've been doing this for as long as I have, oftentimes the facilities will come to me and negotiate because they know that I only bring them qualified people. And so sometimes you can get better deals by working with me because they know it's a competitive situation and they want to go ahead and put their best foot forward because they know I only bring them good people.
Thank you.
Okay.
Great.
I really appreciate all the questions. I'm always happy to talk to you or your clients directly. You can always call me anytime. I put my LinkedIn information in there. I'll go ahead and give you my phone number too. It's 561-303-2242. And you can find me easily on Google if you just Google me. And you can, I'm under Senior Care Authority, Palm Beach County. You can also find me that way as well, Jodi Glacer, Senior Care Authority. Thanks so much, Michael, for the opportunity. I really appreciate it.
Hey, it's our pleasure, my pleasure to connect you with so many people who need to know what you do and all this wealth of knowledge you can offer. So thank you.